you'll hear a lot of people talk about behavioral health, and that's the thing. Obviously, I'm the CEO of the Alaska Behavioral Health Association, so behavioral health is top of my mind, but we're seeing a behavioral health crisis. The lower 48 sees a behavioral health crisis, but in Alaska, we're seeing our own behavioral health crisis, and that it hits all sectors of healthcare. And I think, one of the things that's tough about healthcare, it's a very complicated system, and everybody's coming at it from different angles, and suddenly behavioral health is a problem that everybody needs to deal with. And so if we're not all on the same page, working in the same system, working with the same rules and regulations and styles of dealing with things, then we're just getting fragmented solutions for a broad problem. So the problem is the problem across the country, but Alaska, we struggle with the infrastructure of healthcare, just because, in general, we are the frontier. You don't have roads that go to every community. So how are you going to build a healthcare system if somebody has to take a plane to get to an appointment? And so the problem is unique in that way. It's, you can go to the lower 48 and see solutions that they have, but they're not going to fit Alaska. And I know every state says that, but it's particularly about the infrastructure here. And so if we're not looking at everything from an Alaska lens of like, that's great, can it scale in Alaska? Then you're just going to end up with stops and starts constantly. We talk about parity. That's a buzzword, but it really is about, like I said, we need to be in the same tent, speaking the same language, with the same tools, working together. And when you have community behavioral health providers that have to go through such a different, complicated system, and that's how you end up with people getting treatment in the emergency room, and they can't get into that behavioral health system in the community. And so it's about parity, letting our workforce work the same wherever they're going to be. And with that parity comes, we need rates that will pay for services. You talk about the cost of services, and so many people think about behavioral health care as charity. It's not healthcare to a lot of people. It's this other thing, and it really is. As we're seeing, behavioral health is health, and so that you've got to be able to have those services that pay for the costs of providing them. And right now, we're just kind of circling the drain on payments, and so that's something that I think nationally we're seeing, but in Alaska we see as well. And then, because I have a million, the other thing would be gutting out a lot of the administrative burden of delivering services, which is not to say let's unregulate. It's just there is stigma baked into the system, and so when your providers are having to explain what they're doing just to get paid because they're a behavioral health provider, when a doctor can say, you've got a broken arm, I'm not going to treat this broken arm, it's just, that goes back to the parity, it goes back to all working on the same, in the same landscape.